Mr. Ting Ru.
Mr. Speaker, 3 long years of pandemic living was announced to be at an end just last month, and many of us heaved a sigh of relief that the remaining measures of our pandemic response were finally behind us. Given the serious and uncertain nature of the pandemic, it was a testament to the hard work, dedication, and resilience of our nation, especially our frontline workers, that we pulled through. And now we have before us the government's internal review of our response being debated today, from which we all hoped to be able to better inform our actions and decisions when facing the next public health crisis. While we have comments about the way the review has been conducted, I do believe the report is helpful in identifying the lessons we can take away to build back stronger. First, I will touch on some comments and observations about the communication surrounding our pandemic response before speaking about where I feel our focus should be as we move forward to build our resilience as a nation and as a people. The white paper states that effective communication and high levels of public trust were crucial in handling the crisis. Indeed, many of us remember being glued to our screens each time the Prime Minister spoke or a press conference was held by the task force, wondering what the latest updates would be and what changes were awaiting us. Yet, I think it is worth reiterating some observations that I made in my speech in this House in July 2021, just after the second heightened alert phase was announced. It may seem like a distant memory today, but it was a time of great difficulty, especially for our businesses. The spread of the Delta variant from the breach of our barriers in Changi Airport, along with the Jurong Fishery Port and infamous KTV clusters, meant that our businesses, and our restaurants in particular, had to constantly change plans at short and sharp notice, lurching from trying to adapt their operations to cater from one highly complicated set of rules to the next. It was also a source of great frustration for businesses and organizations that they often had to wait for a few days for rules that were specific to their sector to be announced. I therefore believe the call we made in July 2021 is still relevant, and that we should ensure that we develop a roadmap for future use, clearly laying out support measures pegged to specific restriction levels. It would also be important to share how the authorities weigh up various factors in deciding what restrictions to impose, along with the level of support that will be meted out to individuals. While we all acknowledge that it is difficult to set these matters in stone, having more information and understanding about how decisions are made would be important for both businesses and individuals to plan forward and be psychologically prepared for the various ups and downs that come with any large-scale pandemic, like the one we have just come through. Still on communications, one area which we perhaps could look into is to work out a system of improving our existing structures to ensure that our agencies are able to more smoothly integrate the information they have and to be efficient in processing this. I make this comment after receiving feedback from residents and friends who were subject to quarantine orders, who told me that they often receive numerous calls from different departments of various ministries, each asking them for the exact same information which they had already provided. One even told me that an officer turned up at his house to issue a quarantine order the day after he returned to Singapore, after he had spent much time on the phone with and sending documents to various departments and was already cleared from needing to quarantine earlier that same morning due to being a recently recovered patient. The shift to home-based quarantines, otherwise known as the Home Recovery Program, rather than quarantine in dedicated facilities, likewise also resulted in much confusion and jammed hotlines as worried Singaporeans tried to find out more about the new protocols. One area which we also feel warranted more attention in the review and also our future plans has been the impact that COVID has had on the mental well-being of our population and the development of our children. As I mentioned in the recently concluded budget debate, we appear to be reporting increased feelings of isolation and loneliness, and this has a direct impact on our life and healthy life expectancy. Also, many educators have said that they have noticed our younger children appear to be struggling more with mental health and developmental issues, and that the Singapore Youth Epidemiology and Resilience Study found high numbers of youth have reported mental health symptoms. Just yesterday, the Straits Times reported an MCI poll's findings that while most Singaporeans believe they emerged from the pandemic in good shape, more households with children and elderly reported drops in quality of life compared with the general population. Likewise, 38% of youth aged 15 to 19 reported drops in the quality of life compared with 28% for the general population. Yet, there has been scant mention of well-being and mental health in the White Paper. The pandemic led to job losses, business failures, school closures, and families spending extraordinary amounts of time together indoors, which have in turn led to unprecedented stress and pushed our coping mechanisms to breaking point. And on top of everyday anxiety over catching an unknown and possibly fatal illness, individuals, families, and businesses have had to cope with movement restrictions and ever-changing rules relating to what we can or cannot do. I hope that the promised protocols and provisions for mental health for Healthier SG will be made available as a matter of urgency and that they will sensitively take into account the after effects of COVID and findings of the Mental Wellness Task Force. And even as we move forward from COVID, we must not forget to pay special attention to the gaps that were exposed by the pandemic. A 2021 paper by RSIS stated that residents in the lower income groups were more disproportionately hit by lockdown and movement restrictions, and that Malay respondents to the study were more likely to report adverse economic effects as a result of the movement restrictions. These areas bear special attention, as such groups may have fallen further behind, particularly in the wake of the high inflation we have been experiencing over the last year. Additionally, as I mentioned in my speech during the government's white paper on Singapore women's development, I asked about the effect the pandemic has had on the gender wage gap and the effect of the chronic undervaluing and underpaying of work, paid and unpaid, that is traditionally done by women. This is despite this work being deeply important and essential, as all of us learned firsthand during the lockdown days in particular. While we have seen some wage adjustments to various sectors from education and care work, this does not address the hard work that needs to be done to ensure that our structures reflect the great value that we must place on the work that these often invisible and overlooked workers do. These points have also been backed up by studies and data, such as the UN's findings on the disproportionate adverse effects that COVID had on women and girls, including the negative impact on economic, physical, and mental well-being. There was also concern that women and children were being exposed to higher levels of domestic violence, and indeed in Singapore, there have been findings that family violence has increased from 2020 to 2022. I also hope that the attention can be given to the still little-known phenomenon that we often refer to as long COVID. This is what happens when survivors of COVID find themselves being plagued with a variety of effects long after they have recovered from the acute phase of the illness. These can range from gastrointestinal problems, fatigue, respiratory symptoms like shortness of breath, to cognitive impairments, alongside psychological conditions such as depression and anxiety. And while findings are mixed, some studies have even suggested that women, older people, and those from minority ethnicities appear to be more severely affected. There is natural concern about economic and health impact, adding to the hidden toll of the pandemic that we must not forget. Indeed, a recent meta-analysis published in The Lancet even seems to have found a worrying 45% of patients, regardless of hospitalization status, still suffer from unresolved symptoms 4 months post-infection. Indeed, The Lancet also recently estimated too that approximately 65 million people worldwide are estimated to struggle with long COVID, and 1 in 10 people with long COVID stop working, and this results in extensive economic loss. Given that we have reported more than 2.2 million COVID cases, even a small percentage of this would be significant. While I acknowledge that the condition is poorly understood, complex, and variable, the Ministry of Health stated in April last year that it did not track the incidences of long COVID. This is a missed opportunity, not only because it means many recovered patients, particularly those for whom these after effects may not be severe, may be suffering in silence, and it affects their productivity both at home and in a workplace. They also do not have access to the treatment and care that they need to have a better quality of life. It also means we are not capturing data about whether certain groups are more adversely affected. We are therefore missing the chance to be able to provide more efficient, targeted measures of support and education for these groups to be given the timely and adequate levels of help that they need. This has implications on the physical and mental well-being of our population, with an impact on our recent moves to a different approach to health and the expected increased care cost burden as our population ages. Equally alarming too is the finding by Mercer Marsh Benefits that Singapore ranks lowest in Asia for help given by employers to make adjustments to the job to cater to employees suffering from long COVID. Additionally, many people I speak to would mention that they are not quite the same after coming down with COVID, but are either unaware of or do not understand what long COVID is. How do we ensure that sufferers are seeking both treatment and help, particularly for those whose livelihoods and abilities to either work or study have been affected by poorer or suboptimal health? There is also a sense that weakened immunity post-infection, coupled with the removal of social interventions to curb the spread of COVID, has also led to the circulation of more cases of infectious diseases like URTIs, and I hope that we can be mindful of this as we track workplace and educational performance for these affected individuals. I would also like to seek a clarification now that we have fully shifted to living with COVID. I understand and appreciate that the full subsidies previously offered to patients suffering from COVID are being stepped down. In particular, COVID antivirals such as Paxlovid will remain fully subsidized for clinically eligible patients in outpatient settings, and further understand that hospitals will now start to charge for these important medications. Would the Minister be able to confirm that this is indeed the case and to explain the rationale behind such a move? After all, the drugs are meant to be prescribed to high-risk patients who are more likely to be seen in hospital settings. Finally, to close on a personal note, I would like to record my deep gratitude to the dedicated individuals who push through their stress and fatigue to provide high standards of care for all of us who were in the hospitals and other care settings. This included my then 1-year-old when he was warded at KKH after suffering from a COVID-related emergency just a little over a year ago. Your compassion, kindness, and understanding never wavered towards a bewildered and confused pandemic baby, unused to strangers and foreign environments, despite him crying through the night at 15-minute intervals, and I am forever thankful for how you cheerfully suited up each time so that you could hold him and try to calm him while I snatched precious moments, seconds to use the toilet. We owe our post-pandemic freedoms today to our everyday heroes, and I hope that we do right by them and repaying the debt that we owe them by valuing them in concrete ways and also by ensuring that the sacrifices made and lessons learned along the way are implemented in any future public health crises that we face. For that, I support the motion. Thank you.